Thank you, everybody, for joining us. We're excited to go through the findings of the trend survey and dig into some of our own data. It's going to be a great time if you like large numbers. We have a great group here with me today, and we're all from the National Health Practice here at Segal. Jason and I are humble actuaries. Matt and Sarah, a little bit more interesting. Matt's a PharmD and a data scientist, and Sarah's an RN with experience in informatics as well. All of them elite analysts operating at the top of their game and able to take us through this from a lot of different angles today. So let's get into the agenda, which is really everything about trends, results from the survey, what's driving some of those results, some things that we're seeing in our own data warehouse, and then we're going to get into some cost management strategies and some things that you can do about it. And then at the end, we'll leave some time for questions. So if you have questions, there is a Q&A. So the chat here is disabled, but you should be able to submit questions in the Q&A. And go ahead and submit those whenever they pop into your minds, but we'll tackle them either throughout or maybe right at the end, but feel free to submit those at any time. And you should also be muted as well. That's all the housekeeping stuff I was supposed to say at the very beginning. So without further ado, these are the results of our most recent trend survey. And so you'll notice, we'll just start off here with the RX. So the RX for a few years here was in a pretty tight range. You see, of course, the COVID disruption on medical, which didn't really have a big effect on the drug side. But then coming out of COVID, there were several years here where it was pretty close to 10%. And that's the expectation for the rest of 2026. But there's some pessimism heading into 2027. So we'll get into some drivers, some things that we think are applying pressure both upward and downward. But the sentiment within the industry is that this is going to continue to increase or have a bit of an increase up to 11.5% into 2027. On the medical side, focusing primarily on the PPO side. Now, pre-COVID, it would have been really common to see these in the 6 to 7% range. I think that's what a lot of us got used to seeing medical trend at. Coming out of COVID, there was sort of that delayed impact from inflation that ran through the rest of the economy. Thank God all that's over. And for a few years there, it moved more towards 6 to 7, 7 to 8. And then if you remember last year when we were talking, this 2025 number was a bit lower. The expectations for 2025 were more like 8%. And then there was some expectation of something a little bit higher for 2026. And if you'll recall, I said it then that I thought that was an understatement and that 2025 was going to end up coming in a bit higher and that we wouldn't be surprised to see these trends get close to 10%. And so the industry is caught up with my clairvoyance, and the expectation now for the end of 2025 was that 9%, and then 2026 and then into 2027 is right around 10%, focusing on the PPO here. And so that's 2 years at 10%, which is very significant on the medical side. This is somewhat historical territory for medical trends to be sustained at this high of a level for this long. And then I mentioned some of the expectations from last year. And so this year we also allowed submitters to restate 2026. So what you'll see here is the original amount, what they thought 2026 was last year or would be last year, and then now where they think it's going to complete, at the end of this year. So that's the 2026 restated, and then 2027, what they expect for next year. So on the HDHPs and HMOs, not big movement here, but I consider those tend to be a bit more volatile, not quite as credible. PPOs is really where there's a lot more credibility, and I consider that more of a bellwether for general sentiment. And that is how I read these surveys in general, is that don't think of this as in terms of the specific numbers, but just generally the magnitude and direction is a good indicator of market sentiment. So is the market sentiment optimistic or pessimistic? Don't get hung up on the exact number per se. But as I said just a moment ago, they restated up. Last year, they thought it would be 9%. This year, they're thinking 2026 ends at 10% and continues at 10%. So we'll spend a minute on this slide, but we're certainly not going to go through every single one of these bullets. But this is some of the common things over the last 5 or 10 or so years that have had a material impact on trends. And I'll actually start kind of more towards the bottom of this list and briefly touch on regulatory changes here. So this is, more recently, there's been a lot of press, a lot of discussion around the impact of the No Surprises Act and the independent dispute resolutions. And if you're not real familiar with that, the No Surprises Act, the intent was in certain situations where a member is receiving care and they're surprised to have been treated by someone that is outside of their network. So they went to an in-network hospital and there was an out-of-network physician, or just services that they didn't expect entirely that happened to be done out of network, like an anesthesiologist. And so in these scenarios, the intent of the legislation was, well, let's take the member out of that and let's put it between just the payer and the provider, hold the member harmless. And the intent was that this would be settled at a market rate. Like, we'll just make sure that the provider gets paid at a market rate. But what ended up happening, of course, is that this became an opportunity for providers to get inflated payments. And the way this process was set up strongly favors the provider. It's also very opaque. And what we've seen happening is 70, 80% of the time, providers are winning. And in some cases, it's 5, 10 plus times what a typical market rate would be. Assistant surgeons getting 10 times what the surgeon got, because they were out of network, things like that. And so it's kind of changed business models within the provider community and created more of an incentive to remain out of network than to come into the network. And this has gotten a lot of bipartisan focus. Recently, just today, there was a New York Times article about the current administration looking at it. So this may be something that gets amended. Hopefully it is in the near future. It gets clarified to be more like the original intent. But for now, this is definitely something that's applying upward pressure to trends. And it may be something that's running under the radar as these tend to not stand out in reports. It might look like just regular in-network services in your reports. Another one we'd like to mention is AI, and there's a lot going on relative to AI. There's the cost of implementing AI, and then there's other things like the effect that AI might have on billing. And so I'll hand it over to Sarah, who can elaborate on that, and then maybe take us through a couple other bullet points here. Sarah?
Sure. Thanks, Eric. Yeah, we've gotten a lot of questions from our clients about how is AI affecting my costs and my trend. And we've known for a while it's not making anything cheaper. But what we're starting to see is we're starting to get some statistics like we're thinking a 3 to 4% increase of your trend is driven by AI. So what is that about? We're seeing that providers' billing platforms are using AI to be more efficient and upcode claims. So before this was done more by hand to maximize revenue, and now they have a way to do it large scale and quickly. So that's, of course, something that's meaning higher dollars per claim, potentially because of AI. And then, of course, on the other side of that, we see the carriers, the payers, the big networks. Some standalone solutions are offering these AI buy-ups so that you can fight machine with machine, right? Where you can use AI to try to find when things have been improperly upcoded. So basically, we're in the big battle of the AI now. So that's the first time that we're really starting to see these tangible effects of AI driving up trends. So that's unfortunate, but it's the world we're in today. The other bullet I'll mention here is provider consolidation. So we've seen providers consolidating for a few decades now for various reasons. The most recent big impetus here has been private equity, of course. So especially in the last 10 years. So what is that about? We have a lot of folks who are seeing the opportunity to make some profit, to jump in, especially into areas where there's some legislation that is mandating or encouraging coverage and meaning rapid expansion of certain types of facilities. So like the nursing homes, skilled nursing facilities, rehab for substance use, applied behavior analysis. Those are some of those areas where private equity is getting very involved, making these consolidations, sometimes being kind of like the single player on the market in certain areas. And this is not a great thing in terms of outcomes either. Sometimes we see, most of the time we see some concerning outcomes, like nursing home residents have a 10% increase in their likelihood of dying if they're in a private equity backed facility. So provider consolidation, especially because of private equity, is something that we are concerned about and that we know is definitely driving the trend because it has such a big impact for cost.
Yes, thank you. Yeah, they don't tend to get into markets with the intent of bringing prices down or not making a big profit. And there are a lot of macro studies out there. There's a lot of press coverage on this as well, and even some bipartisan focus on this effect as well. So hopefully some of these will start to see some movement. And of course, plan to plan experience is going to vary. Like I said a couple slides back, not to get fixated on the specific numbers, but to treat it more like general sentiment, as there is, a range around these numbers that different plans will experience based on these different factors here on this slide. Of course, high cost claimants, can be very volatile 1 year to the next. There can be a very big difference. Plan to plan can be a very big difference. Different plan design features, different demographics. Some trend drivers are just going to hit certain parts of the country or certain demographics more acutely than others. And then, of course, what cost management strategies are in place. If you had a robust strategy to address obesity and GLP-1s, you would have very different trends and outcomes potentially than a plan that was more hands-off during all of that. This exhibit here highlights, kind of tries to bring the impact of this home a bit and highlights the effect that this could have on suppressing wages. So this is a hypothetical scenario where the employer has a certain budget for doing wage increases, and then that is offset by the increasing cost of healthcare. So in this hypothetical scenario, that full increased cost is getting passed to the employee, which of course in practice doesn't tend to happen. Our experience is that the employer tends to absorb as much of that increase as they can, but even indirectly, it has to have an effect on budgeting and other operations for the employer. And so in this hypothetical scenario, a 4% wage increase on an employee making $80,000 a year, and that if there was a 10% increase in healthcare costs, which is what is projected, this would be a $2,000 increase in cost that gets passed along to the employee. And unfortunately, that is accurate math. That does reflect where household healthcare costs are today. And so you could see that this is eating up the majority of what would have been the wage increase for that employee. And we show this here with different healthcare inflation numbers just to show how sensitive that is, that there's a big difference between the 6% that we used to see, not uncommon to see pre-COVID, where the employee is still retaining the majority of what would have been their wage increase, to this now 10%, which is this scenario here, where they're only able to keep 37.5%. So this can make a very big difference to the take home for each employee. And this is a challenge for employers to manage as they try to keep employees happy, offer a good wage, and then offer a competitive benefit in this environment where we're in, where healthcare costs are so high and so sustainably high. So this exhibit here highlights the difference between historical actuals and what the original projections were. And you can see my 8 to 9% gap here for 2025. And I'll hand it over to Jason to talk more about this and then to get into some of the specific drivers that we see on the medical trend side. Jason?
All right, thank you, Eric, and hello, everyone. So I will be taking us through our next section here. We're going to look over some more results from our trend survey. Like Eric said, we're going to mix in some trends we're seeing in our own data warehouse. But first, the slide we're looking at here, this looks at responses from our trend survey We're looking specifically at medical PPO trends in the commercial market. The dark blue line here is the projected trend figures that we get through our survey. The turquoise line is the actual trend figures we get also through the survey. And then the purple line is the CPI value in a given year. So if we focus on the left side of the graph here, we can kind of see, before the pandemic, healthcare was in a more or less predictable state. Healthcare trends, medical trends specifically, were 6 to 7%. Projected trends are about 1% or so above that in a given year, which is typical to see. There's going to be some conservatism in a projected figure. And then we had CPI every year about 2%. So, we had our healthcare trend well above CPI, but it was more or less predictable. It was a constant state of affairs for leading up to the pandemic, at least. And then we get into 2020 to 2022, things got a little chaotic and unpredictable. We actually had 2 years where CPI exceeded healthcare trend, which I've certainly never seen in my lifetime. It's very rare to see, but that happened in 2020, also 2022. And when that was happening, it was widely expected that healthcare trends were going to increase to make up for that. It's known that healthcare trends can lag CPI a little bit just because of network contracts and whatnot. So as those get renewed, we start to see that CPI make its way into healthcare trend. So the high trends, throughout the last few years were expected. What's been surprising is just how high they are. If we shift our focus all the way to the right in 2025, the projected trend for that year was 7.9%. If you look all the way back on that line, we never saw that high of a projected figure. So the expectations were high. And then when we look at the actual, it was over 1% higher than that at 9%. So I think it kind of took a lot of people by surprise, at least when those projected figures were provided. But that's just kind of the state of healthcare where we're at now. But we can move on to the next slide. And we're going to start looking at data in our own Shape data warehouse. And if you're not familiar with it, it's a blend of some of our clients in the public sector, multi-employer, and corporate markets. If we focus on the chart on the left here, so what this chart's telling us is the blue line, that dark blue line, that's the median trend rate on the medical side across our clients. So 50% of our clients had trend higher than that in a given year, 50% of our clients had trend below that. So in 2025, we saw 8.9%, which aligns very closely with what our survey respondents were seeing, slightly below the 9% we were provided there. And then we also show that gray bar around the median trend rate. And what that tells us is the 25th to 75th percentile of trend across our clients. So just looking specifically at 2025, we don't have it labeled, but the bottom of that range is at 3.7%. So that means that 25% of our clients actually had trend below that amount. And then the top end of the range is 11.7%. And we had 25% of our clients have trend above that amount. But you can see the range kind of widened in 2025. Even though we're in this high trend environment, we are seeing a lot of our clients managing trend well. And we do get into some strategies later on in the presentation that'll go over, what we're seeing our clients doing, what we're helping our clients with that is helping to mitigate some of these high trends. And then we provided the chart on the right. This is also looking at medical. We're just breaking down the trend figure even further by place of service. So we're looking at inpatient hospital trends, outpatient, and then trends in the professional setting. So the top bar there, the turquoise bar, that is year over year trends, specifically in the outpatient hospital setting. You can see over the last 4 years, this has really been the main trend driver on the medical side. There's a few main reasons for this. A big one is just improvements in technology. We're seeing a lot of surgeries that, 5, 6 years ago, 7 years ago, they were happening in the inpatient hospital setting. Those are moving to the outpatient hospital, which is really, as a whole, a trend mitigator. Because they're a lot cheaper in the outpatient hospital. We don't have members staying multiple days in a hospital setting, which obviously adds up. So overall, that is actually reducing costs, but when we're looking specifically at outpatient hospital, it is raising costs there. Another big one is cancer treatments. We have new cancer therapies that are coming to the market at higher and higher price points. Most of those are provided in the outpatient hospital setting. So that's a main driver there. Another big one that's included in that bucket is the emergency room. That's been a major trend driver for a lot of our plans. And what's really interesting there is when you look specifically at what's going on with utilization and unit cost trends there, it's kind of different than other trend drivers. Other trend drivers we're seeing, it's a combination of higher utilization, higher unit costs. ER seems to mainly be driven by unit costs. So not necessarily members going more, but just those visits are getting more and more expensive. And we did talk about this on our page that touches up on what's driving trend. But what we really think is going on here, at least part of it, is AI making its way into provider billing and just increasing trend through that, through making these ER visits be billed at higher and higher severity levels. And then also the No Surprises Act. We're seeing a lot of these claims that are going through the IDR process. They're being paid at much higher rates than what we would expect. So, if you're a plan sponsor and you don't have a strategy around how to handle these IDR claims, now is really the time to look into that strategy, because that's really driving trend in the ER setting. The last thing I'm going to point out here is the professional setting. So the next line down there, the purple bar, this has been the second highest trend in terms of place of service. In 2025, we saw an 8.2% increase. There's a few things that are driving trend here. The main one is mental health services. We're seeing a lot of need for mental health treatment, and a lot of that's coming through the professional setting. A lot of it's like ABA therapy, ADHD, anxiety, depression. Those are the lead trend drivers there. And then another one is just we're seeing members utilizing their benefits more. And, this might be partly a hangover from the pandemic when we saw a lot of people avoiding the doctor. But we're just seeing more need for evaluation and management type visits, things like that are really just driving trend in the professional setting. Excuse me. That's all I was going to cover on this slide. If you want to move on to the next one, please.
Well, I'm going to jump in on your AI ER comment there, give you a chance to take a sip.
Thanks.
So part of this, we don't want to be, paint with too broad a brush on those AI comments and say that it's 100%, like just like sinister framing. To some extent, this can, medical coding is a skill. It does take time, it takes effort, it takes knowledge. And so it's sort of, you could think of it like everybody on this panel, you could describe everyone on this panel as being between 5 and 6 feet in height. And you could just generalize that to all 4 of us and move on with your life. And so what the AI is coming in and doing is giving everybody specific heights. And so now, your beliefs about each person on the panel is going to be more specific. But if everybody, when that was done, instead of being between 5 and 6, everybody's just 6 feet now, then you would be suspicious of that. And you would say, it looks like everybody's lying about their height. And so that's sort of the sinister side of this, is that people are concerned that AI might be putting its thumb on the scale. But there is some element of this where it's just providing specificity to what really was being done. But both of those will have could have an upward effect on cost, whether it's legitimate or whether it's AI putting its thumb on the scale. So I just wanted to add that little bit of context on there.
Yeah, thanks, Eric.
Go ahead, Jason.
More context.
Continue.
All right, see if I got that frog out of my throat now. All right, so we got one more slide where we are looking at data specific in our shape data warehouse, and then we're going to dive back into our trend survey responses. But this one, again, we're just looking at medical trend. We're breaking it down by these top trend drivers by condition. So how this can be read is the trend rates you're seeing there. That's the increase in that specific condition year over year. So if we look all the way to the right, we can see that the top trend driver is mental health. So mental health costs from 2024 to 2025 increased 14.2%, and that was well above the other types of conditions. The second one is cancer. Cancer increased 10.7% from 2024, and cancer is really expected to be the primary driver of medical expenses in the foreseeable future. I mentioned before, we have a lot of new high-cost therapies hitting the market at higher and higher price points. There's several gene and cellular therapies that are being used for cancer treatments. Things like Carvykti, Breyanzi, Yescarta, those all have very high costs. They're very effective, but of course they are driving trends on the medical side. Another important one you've probably heard of or seen the commercials is Keytruda, which is an immunotherapy drug. That one's used for several different types of cancer, so it's a main trend driver for a lot of plans. The one thing to know about that drug is that the patent does expire in 2028. So this should open the door for cheaper biosimilar options that are just as clinically effective. As we all know, though, these patents can be extended, so there's no guarantee. But for now, that is expected to expire. That being said, there's so many different cancer treatments in the pipeline that we're still expecting cancer to be a significant driver of medical expenses in 2028 and beyond. So it's certainly an area to focus on in terms of controlling costs and providing quality of care to members. And then just rounding out the top 5 here, we have the genitourinary system, digestive system, and then the nervous system. And now we can jump back into results from our trend survey here. We are going to shift gears a little bit more. Before we were just looking at the commercial market. Now we're going to look specifically at the Medicare market. And this is forward looking. So we're looking at the dark blue column is the original trend figures we were provided last year in terms of what trends were expected to be in 2026. And then the middle turquoise bar is the restated trend figures. So how have those expectations changed? And we received these responses a few months ago, but they were a year later than the dark blue. And then purple, we have the expected trend figures for 2027. One thing that's important to note here, trends in the Medicare market overall are similar. They're influenced by similar things as the commercial market in terms of utilization and unit cost and severity mix and things like that. But in terms of the cost that plans actually pay, trends can look a lot different. They're heavily nuanced. A lot of the costs are offset by CMS revenue, but that's not included here. These are gross medical costs. So we're not including kind of that large component that's offsetting a lot of these costs that the plan sponsors actually pay. But looking at the two groups on the left, this is the Medicare Advantage market. The left one's the PPO plans, and the middle one's HMO plans. Really the same story here. Trends were expected to be 6.2% in 2026 a year ago. They're still expected to be 6.2%, so nothing really remarkable happening there. What's really interesting, though, is just that trend expectation for 2027. We're seeing it jump to 7.3% for both types of those plans. It's really a significant increase. It's over a percentage point. So that's kind of the market sentiment right now on the Medicare side. A lot of upward pressure on costs going into 2027. And then on the right, we have Medigap plans. These kind of similar. I mean, the restated trend figure we got for 2026 actually did drop slightly, about 0.1%, but nothing significant there. But similarly, a sizable increase in trend expectations going into 2027. From our survey respondents, we got a trend expectation of 8%. So less severe of an increase is what we're seeing on the Medicare Advantage side, but certainly notable. But just really important to keep in mind, when you're budgeting for these expenses in the Medicare market, really keep an eye on that CMS revenue, which is not included here. Things like the benchmark growth rate, risk score changes, star rating changes, those are vendor specific. So it really depends on what vendor you're working with, but that's going to ultimately change, the trends you're going to be facing moving into 2027 here. All right, so one more slide I'm going to go over here. Again, looking at results from our trend survey, but now we're shifting over to the ancillary benefits, and that includes dental and vision. And these are, of course, influenced in similar ways as medical, just a much smaller scale, but things like labor shortages and wage pressure and just overall inflation does make its way into these benefits. What I think is most notable here is if we look at our 2026 original and 2026 restated figures, they actually went down, which is pretty surprising, or they stayed the same. But for the most part, we didn't see large increases like we did on the medical side. And I think what happened a year ago, when overall inflation, like a year or two ago, when overall inflation was a lot higher, everyone was really expecting that to make its way into these ancillary benefits more than it did. But for whatever reason, inflation did not really have a huge effect on dental benefits. For the most part, the trend's been 4% for years. And that's kind of the expectation going forward. A little over 4% for some of these different types of plans, but overall about 4%. And then similarly on the vision side, trends been hovering around 3% or a little less. And that's kind of the expectation going forward. So for whatever reason, we're not seeing as broad of an impact from general CPI and whatnot within these benefits themselves. And then we are going to start looking at some pharmacy trends. And for that, I'm going to pass it over to my colleague, Matt here.
Thanks, Jason. So as Eric noted earlier, the pharmacy trend has been well above medical trend the last 5 years, and those trends are expected to pretty much continue over the next year or two. On the left, we have those projections for all pharmacy coverage, which Eric talked about at the top of the hour, 10.5%. Restated for 2026, increasing to 11.5% in 2027. But what you can see on the right is that specialty drugs really remain a key driver of trend, with specialty projected trend at 11.9%, so just under 12% for both 26 and 27. And this is pretty interesting to note when you keep in mind that we've seen the release of major biosimilars for Humira and now Stelara on the market. So these products should be decreasing trend. We're not really seeing that being reflected in the projections here, and we'll talk more about that later on. So kind of in general, the story now is that drug mix and a shift towards higher cost therapies is really driving trend. So we'll look at a few of these drivers of pharmacy trend. But on the next slide, we'll kind of do a brief dive into the impact of GLP-1s since they've kind of dominated the headlines the last few years and probably will continue to do so. So, the last slide was our survey results. Now we're switching back into our data from our Shape Data Warehouse. So we're showing you our own Segal data here. And for our book of business, overall prescription drug trend reached 12.4% in 2025. That's the median drug trend. And this just highlights, how quickly pharmacy costs are growing. If you look at that 50% of clients, that shaded area that Jason also talked before about on the medical side, you can see that it's much narrower on the bottom and extends quite a bit to the top. And that bottom, portion of that shaded area is our 25th percentile and pretty much aligns with the median trend rate for 2024. So that pretty much means that 3/4 of our clients have trend at 10.5% or above, which is a massive, massive number, right? And one of the clearest differentiators in trend is whether or not a plan covers anti-obesity GLP-1 medications, which you're seeing on the right-hand side. So for plans that do cover those medications, they had a median trend of 18.3% in 2025 versus, just in quotes, 10.5% for plans that excluded coverage. So pretty much an 8-point differential, in trend covering these medications. Now, I just want to be clear that, covering AOMs is not, a right or wrong decision. These drugs can produce a lot of meaningful clinical benefits. However, employers need a deliberate strategy around eligibility criteria, integration with lifestyle management programs that aligns with their goals of providing coverage of these medications. So, beyond GLP-1s, there's several other therapeutic categories that drive pharmacy trend, which we'll turn to next. So the leading contributors to pharmacy trend are increasingly concentrated in specific drug categories. So previously when maybe 10, 15 different categories made up the difference pharmacy trend, you're seeing the bulk of trend allocated to maybe like 4 to 5 different categories. And we're showing you the top ones here across our client base. Something you'll note is that we're seeing year-over-year trends for these categories in the 20s and 30%, versus the medical side was closer to the teens, more or less. Dermatological conditions like eczema and psoriasis are particularly notable because treatment here is rapidly shifting towards biologics and targeted therapies that carry very, very high costs. $5,000 to $10,000 per month, $60,000 to $120,000 per year, for example, before rebate potentially. Further, we're seeing a lot of manufacturers come out with self-administered versions of their medications, which makes it easier to access these drugs and increases usage. We saw this with Dupixent a couple of years ago. Although it was always approved for self-administration, it was mainly given in the doctor's office. But then in the early 2020s, they came out with a pen-specific version, which shifted a lot of the usage from the medical side to the pharmacy side, and then also increased the user base. Diabetes was pretty much the main topic in the early portion of this decade. We saw a high trend in 2022 and 2023. This is mainly due to the changes to the American Diabetes Association guidelines, which put GLP-1s as first line with the generic drug metformin, which had been pretty much the only first line drug for about 2-3 decades. You're seeing some slight decrease in the trend for diabetes. This is not to say that it's necessarily slowing substantially. It's that you just had a massive rise in 2022 and 23. So it's kind of an equivalent rise on a bigger user base or a bigger cost basis, right? And also now, because of the increased usage here, especially if an employer doesn't cover weight loss drugs, there's potential for off-label usage of these medications. And we're seeing more and more PBMs and employers make sure they have tightened PA criteria or prior auth criteria, making sure they're used only in that type 2 diabetic member. And then lastly, HIV medications is pretty interesting because typically it has historically had a very small user base. So although the costs were expensive for these drugs, $1,000, $2,000 a month, more or less per medication, it didn't have an overall massive impact on cost because the user base was so small. But now we're seeing trend increase quite a bit here, mainly due to usage in prevention, specifically with brand drugs like Descovy. And also some of the new injectables that have been available that, instead of taking a daily pill or every couple of days, you're taking something, they're getting an injection maybe every 2 or every 6 months. But these injectables also may be separated between possibly getting them on the medical benefit or the pharmacy benefit. But in general, one of the best opportunities to offset some of the trend is biosimilar adoption. And we'll talk about that next. So biosimilars represent, one of the strongest opportunities for pharmacy savings. We're looking at Humira and Stelara here, along with their biosimilars, mainly because between these two drugs, historically, they've maybe made up around 10-12% of an employer's pharmacy costs. So a massive portion on two drugs that have a relatively small user base, maybe less than 0.5% of total prescriptions per year. So briefly, biosimilars are essentially highly similar copies of biological medications. So similar to generics, but they're not exact copies, which is what a generic is. Biosimilars may come as what's called a high WAC or low WAC option. WAC is the wholesale acquisition cost, more or less equivalent to a product's list price. So high WAC is essentially high list price, low WAC is low list price, more or less. There's no clear industry definition here with which defines low versus high. It's usually outlined in a PBM contract, for example, and it's should be based relative to the originator's cost. So maybe a high WAC is something that's within 20% or no more than 20% lower than Humira's cost. And a low WAC would be anything above 20% off of Humira's cost, for example. We're showing the relative costs of low WAC and high WAC biosimilars here relative to their originator products. And what you're seeing is that low WAC products are typically 80 to 90% cheaper than their reference product, so Humira and Stelara. Low WAC, biosimilars, a key thing to think about here is that they don't often offer rebates compared to like high WAC products. But that said, it's oftentimes a low WAC product could be a lower net option than something that's a high WAC with a rebate, for example. So it's really important to keep this in mind and also look at a PBM's contract terms on how they allocate for this. One other key thing I want to point out is if you look at the right for Stelara, there is this pink line or magenta line there for unbranded Janssen product. You'll be asking, what is that specifically? So what we're seeing here is that Janssen, who is actually the maker of Stelara, decided to come out with another product of their own that is essentially the same product as Stelara, just without the branding of the name, right? So it's the unbranded product. It's ustekinumab, but it's about 1/3 of the cost of Stelara's product. So this is something to keep track of going forward to see if manufacturers are more often coming out with competitor products to their own product to kind of offset some of the shifting towards biosimilar competition. But it's also something to think about in terms of, well, why can't they just offer the original product at the same price point versus offering two separate products, one at a high price point and one at a much lower price point. The important takeaway here is that, these savings won't happen automatically. We have to be proactive, asking our PBMs or on behalf of our clients, what is the biosimilar strategy of a PBM? When are they going to place a Stelara biosimilar as a preferred product? What's that time delay going to be? So that we can start seeing some of these potential savings, much sooner than later. So that brings us to what employers are actually doing to manage costs. And there's typically no single solution here. Successful organizations use multiple coordinated strategies. The consistent theme throughout our experience is that organizations achieving the best results typically take a multi-pronged approach. And I'll take us through a couple of the pharmacy strategies that you're seeing on the slide here. I mainly want to focus on strategies around GLP-1s and biosimilars, because those are really the two top of mind right now. And for GLP-1s, specifically the weight loss versions of them, not the diabetic ones, there's a couple of different ways you can kind of approach this area. The first is, if you are going to provide coverage, making sure that is through an integrated weight loss management program. That can be something as simple as requiring weigh-ins. There's a lot of, clinical programs out there that provide members with, electronic connected scales that they could, weigh in every week or so. That goes sends to a separate platform to verify that, they're seeing the progress with these medications. So as much as, requiring, telehealth appointments with the care management team for continued prescribing and restricting it to specific provider groups. Another kind of less clinical approach, but more from a benefit design standpoint, is to look at, changes to that benefit design. And we've helped a lot of our clients in this area with analyses such as changing, the cost share. So instead of maybe a $25 copay for a preferred brand, increasing to, whatever, $50, $100, $200, for example. Also implementing lifetime maximums. So maybe covering 270 days or 360 days of this therapy, or even dollar limits. So a $5,000 benefit for these medications, in which, now the member will have to think more closely on which drug do I select, right? Because there's different price points on these. We've also even looked at direct-to-consumer pricing via a reimbursement model for our clients. For biosimilars, which impact, both specialty costs and also kind of relates to clinical controls, applying effective clinical controls. We should ensure that PBMs are, obviously preferring the lowest net cost option, since we see very large, price differences between these products, 80 to 90% price difference. And even again, with rebates, it still may be an additional 20% savings on top of that. Additionally, we shouldn't be limiting biosimilar adoption analyses to just comparisons against Humira or just comparisons against Stelara. It's great if you have 100%, Stelara biosimilar adoption, but if the number of users within that Stelara bucket is decreasing, that's a bigger concern. Humira and Stelara compete against a lot of drugs: Skyrizi, Tremfya, Rinvoq, other high-cost therapies, right? So we should be monitoring these, biosimilar adoptions in this entire competitive landscape, in the entire bucket of medications. It's like I said, it's one thing if you have 100% biosimilar adoption, but if you had 20 Humira users in the prior year, and this year you have 10 Humira biosimilar users, where do those other 10 go? Did they switch to a more expensive therapy? Did they shift towards from Humira to another AbbVie product like Skyrizi or Rinvoq? That's something we really need to keep in mind and also track, to make sure we're managing costs as effectively as we can. So next, I'll pass it on to Sarah for her thoughts on medical strategies.
Great, thanks, Matt. Yep, we just heard about the pharmacy side. Now I'll talk generally about the medical side. So here are some of the strategies that our clients are considering. First one, well-being services. So traditionally, I think we thought of well-being services as more of the nice thing to do, but not something that had a direct impact on cost, especially in the short term. You think about the person who gets on healthier habits and they walk more a day, and now maybe we're preventing a stroke or a heart attack, 15 years from now, but we're not seeing that effect immediately in healthcare claims. But what's different in the last year or two is for the first time, we're starting to see some vendors are putting fees at risk for return on investment, a more direct impact between well-being and actual cost reduction. So why do we see this ROI? It depends on what the vendor is and what the well-being service is, but like using mental health, for example, if someone is better centered emotionally and mentally, they're able to take care of their physical conditions. That's saving emergency room visits, hospitalizations, that kind of thing. So it's exciting that we're starting to see well-being as a strategy for cost management. Next item is target high cost claimants and high cost conditions. So we're doing this more and more at Segal. We're meeting to talk through folks who have high cost conditions and are incurring a lot of costs. We're meeting regularly with the carriers and the providers to discuss, are they receiving the best care that they should be getting? Was there any indication that the services or the facilities that were providing the care maybe missed something that we can go back and address? So whether that's like a site of care issue for, say, an infusion that could be at a lower site of care, that's an example of something that we would have the ability to impact and address that for a specific individual. So it's not like members are at fault, but there's a lot of predatory provider practices and advertising telling members this is the place to go for the best care or whatever, and those are often the most expensive. So the participants don't really know if they're getting the best or most effective care, and that can be a huge difference there. Also, we can keep an eye on other site of care issues, stories about members getting the wrong chemotherapy drug because they didn't have the correct oversight, and they're wasting money, they're wasting time, not getting the treatment that would actually be the treatment that would work. So that's really where that in the moment support, looking at high cost claimants regularly, can drive some efficiencies and provide better care. The use of AI is the next one. We've talked about this a bit already, where we have a machine against a machine here. That's an opportunity to make sure that we're not getting bamboozled by those providers who might be a little too competitive in how they're upcoding. Narrow networks, that's another one. So that's not about taking away choice, but more toward incentivizing people to use the highest quality options that are out there. So higher quality options mean more efficient treatment most of the time, especially when you have a center of excellence arrangement. So people are getting the right care right away, not wasting time, not wasting money on things that are not as efficient. The next one we have is out-of-network negotiations. So keep an eye on your out-of-network spend. We see this often kind of hidden and not called out by the carriers, and it can be huge. If you see a provider that is coming up as out-of-network repeatedly, a lot of your participants are using it, that's time to reach out to find out why aren't they in the network? Maybe it's a quality issue. Maybe they shouldn't be in the network. But if they're a good quality provider, maybe you have some options to explore, like getting them a direct contract to your network or advocating to get them added by your network carrier. And then the site of care steerage, I already touched on this briefly, but especially for medication administration of drugs, we're seeing between the different levels a huge savings. So as you move down the waterfall in levels of care, when that's clinically appropriate, you're saving about 10% each time. So you have that higher level, that inpatient hospital or the hospital-based outpatient centers for infusions. If you can bring that down to outpatient facilities, you're saving about 10%, down to ambulatory infusion centers, another 10%, and then to physician offices or home infusion services, which can be the most costly if that's appropriate for the participant. So those are some of the things that we're hearing our clients talk about, consider in terms of managing their costs. Eric, anything you'd like to add?
Well, I'm going to push back on your well-being services about going outside and taking a walk. Living in Texas, it's like 105 right out there today. I think if I go outside and take a walk, I might have a stroke rather than prevent a
you
stroke.
need a treadmill.
But I will say, I will echo the comments about focus on the network. When trends are really high in this type of environment, plans are very focused on what can get me, direct savings in the near term. And a lot of other strategies are more long-term plays, and that's good. That's fine. We should do those things. But when trends get really high, we do tend to see people look at their network. Am I with the right vendor? But not even that. Am I going to the right Are my people going to the systems that we want them to go to? Is there opportunities for us to improve steerage or improve what's going out of network? Or now with the No Surprises Act, can we do better on our win rate on the IDR process? Things like that. All of those sorts of things can really go straight to the bottom line and have a good near-term effect. So it's not too surprising to see the emphasis on that. So real briefly here, we do have some questions we'll get into, so I want to leave some time for that. But I will speak briefly about Segal's consulting approach, as we are Segal and it's our webinar, so it's our right to talk about ourselves for a minute. As you see here, really our whole approach centers around data analytics, which makes sense given the presenters here are the ones working on this deck. We're very focused on this. But it speaks to the fact that solutions are not one size fits all. If it was that simple, you wouldn't really need much from consulting. But there's a lot of variability in plan goals, plan populations, regional variations. There's just the most important thing is to know is that you need to start with your own data and understanding your population and your goals, and have tailored solutions that are specific to as specific as the plan is. So we highlight a few big areas here, and this isn't all encompassing, but vendor management. And this can be a whole host of vendors, not just your PBM and your medical vendor, but point solutions and many others along the way. Population health management, plan design management, all these different components. Everything kind of comes together and works as a system. It all has to make sense together and work together and be efficient and be optimized and make sense for your plan's goals. I like to think of this a lot as, you know where you're trying to get, the goals for your population, and we are here to try to help you get there in the most efficient and informed way possible. So with that, we will get into a few questions here. And so here's a QR code for a download of the survey, and then a QR code for feedback. And we do love to get feedback. We love to know what was effective and what wasn't, and anything that we can improve. But for one of the questions here, I'll jump back to this slide on GLP-1s. There was a question about, so this is about drug trend, is the difference, the difference in drug trend covering GLP-1s. What are we seeing so far on the medical side based on coverage of AOMs? And I'll put that to Jason.
All right, so we kind of purposely left this one out because any of our clients in Shape who cover AOMs, we're constantly monitoring their medical experience, and it's really all over the board here. It seems to come down to how adherent are members with the medications, and then how well are the side effects being managed. I will say, generally speaking, we aren't seeing much evidence that medical trends lower if you cover AOMs at this point. But when you kind of look closer, it becomes much more clear what the impact of these drugs are. Like, we're seeing lower trend on the inpatient and outpatient hospital sides, but we're seeing higher trend on the professional side. So, members, when they take these drugs, they're engaged with their PCPs, their specialists, they're constantly having encounters with the healthcare system, and any encounter, costs money, it's expensive. So that adds to trend. So that's kind of offsetting some of the benefits we're seeing. And then from a condition standpoint, none of it's really too surprising. We're seeing higher trend for the endocrine and metabolic claims. So think like diabetes, obesity, nutrition, things like that. And those are really because of what's happening in the professional setting, members being engaged with their specialists. We're also seeing higher trend in the musculoskeletal system. So what's probably going on there is members are losing weight, and they're tackling other problems. They're getting that knee surgery done or whatever it may be. Another area I'd say that stands out, or really two more that stand out that we've seen higher trends in for plans that cover AOMs, is the digestive system, and that's going to be complication related. We are seeing a lot of high trends there when complications aren't being managed effectively. And then also injury and poisoning. So it's really drug poisoning or overdosing or underdosing or something like that. We see those claims a lot, and that's driving trend. The one area that's clear, where there's a clear benefit for plans that cover AOMs, is the circulatory system. So think like those cardiovascular claims. A lot of them end up as, catastrophic, really high cost events. We are seeing significantly lower trend there for plans that cover AOMs. So there's kind of a push-pull effect going on. There's some areas where they're benefiting and it's clear, some where it's not so much. But I think it's just important to note here that we're at the very early stages of the effects of these drugs. A lot of those clinical studies have 5+ year timelines. So it's something we monitor closely, and the effects are going to be more obvious over time. But just, overall, we're not really seeing broad evidence of the cost of the drugs being offset by lower medical costs.
And when you see these headline numbers, because you see studies published that'll just claim with a big headline that they're seeing big medical savings, a lot of times when you read into the details, you'll realize that what they're looking at is something very specific or something more narrow than what's obvious from the headline. So always read those studies and see what they're really saying, because that's not something that you want to just take a headline and then go make a big coverage decision based on it.
Right.
So we're getting. There was one other good question in here. I mean, there were several good questions in here, and feel free to, especially if you're a current client, feel free to reach out to us just directly with some of these questions if we don't get to it. But there was a good question early on about our drivers of trend slide where we mentioned fee for service, and I wanted to make sure we covered that one, and that's maybe a kind of a good one to end on, unless we have time to squeak in another one. But why is direct fee for service a trend driver? And essentially, that's kind of a big. I mean, that's sort of our healthcare system in a nutshell is really fee for service. So it's sort of a broad point for that slide. But if you think about it, most entities in the healthcare system benefit from volume. So there's not a lot of incentive for very many entities to try to control utilization or even to try to control costs. Now, I don't get too conspiratorial about it. My background is from a health insurance company, and we had a lot of meetings about controlling costs and trying to control trends. So it's not like everybody's out there trying to, work against you. But for the most part, drug companies, individual doctors, hospitals, everybody benefits from more volume because they get more revenue. And so that's kind of the idea behind fee for service as a trend driver. Is just that you need somebody on your side kind of working in your interests, and a lot of the other players in the ecosystem are kind of working directly against you. How can we get revenue up? And that revenue for them is increased utilization because the model is fee for service based. So hopefully that answers that. Is there any other? There's a lot of questions that have just come in that I haven't been monitoring. So we maybe have time for one more if somebody else sees a good one to end on. But I would remind you to download the survey and provide feedback. So is there a good question in there, Jason, Sarah, Matt?
There's one. I mean, there's several good questions, and the ones we don't address, we can follow up on. There's one here on how much do social determinants social determinants of health impact trend. And then a second part of that is how much of trend for medical and pharmacy is related to increased usage versus increased pricing. I know on the medical side, just answering the second one first, it's a little easier. On the medical side, we are actually seeing that the unit costs are driving trend more than utilization right now. 2024 was the exact opposite of that. And they actually both increased in the last year, but the unit cost increased a lot more. And we talked about some reasons why that might be happening earlier on in our presentation. But then the first one's a really good question. How does social determinants of health impact trend? And it's a very nuanced question, so I'll try my best to simplify it. But there are codes for these types of issues members face, and they're not used very often. So when you look specifically at those codes, it doesn't look like there's a big problem going on. But what we've done for clients is we've looked at members with specific issues, social determinants of health issues, and then how that impacts other areas of healthcare. So if you're diabetic and you're also fighting one of these SDOH issues, what does that do to your outcomes? And we tend to see a huge difference in outcomes for members with the same chronic conditions, but one has an SDOH issue present and one doesn't. Like 50 to 100% higher claims. So there's definitely a lot of challenges when you're fighting issues like that. I think it affects how you manage your other physical conditions. But that's really kind of where those claims show up. They're kind of hidden. You don't really know that it's a SDOH issue, but underlying, that's really what's going on. Is there's worse management of physical conditions when these are present. So they're very important to focus on, not to ignore, even though you're probably not going to see a report that really highlights how big of an issue some of these are.
Thanks, Jason. And I've seen some comments about the QR codes not working. So I think at the risk of speaking for the people who are responsible for that, I think we can email stuff out. And if you have feedback, it wouldn't be anonymous if you email it, but we'll take it anyway, not take it personally. But yeah, we'll try to email to recipients here, or you'll see other posts. Like if you follow us or any of us on LinkedIn, I mean, everybody shares posts, and that should have links to go download the report. We'll make sure to give you a lot of opportunities to go get that and read it. There's a lot in there that we didn't cover in this webinar. Okay, now someone's saying it does work. I don't know, but thank you for joining us. We're at time today. Thank you guys for joining us, and let us know if you have any feedback or comments or questions, or if there's anything that Segal can help you out with.